3 weeks ago, a woman named Claire walked into my clinic carrying a golden retriever named Baxter, 10 years old, 68 pounds. She had to carry him because his back legs wouldn't hold his weight anymore. When I pressed on his abdomen, I felt something that made me stop mid-exam. His kidneys. They weren't soft. They weren't the smooth, bean-shaped organs I should have been feeling through the muscle wall. They were hard, dense, almost calcified, like 2 stones sitting where healthy tissue should have been. Claire had done everything right. Annual checkups, premium food, daily walks until his joints started slowing him down 6 months ago. And that's when she did the thing that, in her mind, was the most loving decision she could make. She went to the pharmacy, bought a calcium and vitamin D supplement, the same one her own doctor had recommended for her bones, and started crushing it into Baxter's food every morning. Every single morning. For 6 months. The answer to what was destroying Baxter from the inside was sitting right there on her kitchen counter, in a bottle she bought out of love. What I'm about to walk you through, 3 hidden dangers in supplements you may already be giving your dog, and the one safe alternative that actually protects their joints without poisoning their organs, is something I wish every dog owner heard before their dog turned 7. And the signs that something is going wrong have probably been visible for longer than you realize. You just didn't know what you were looking at. Stay with me. Let me explain what was happening inside Baxter. Because it's probably happening inside your dog right now, and neither of you know it. Think of your dog's kidneys like a mesh strainer sitting in a kitchen sink. When your dog is young, 2, 3, 4 years old, that strainer is brand new. The mesh is tight, clean. Water pours through and all the waste, all the debris, gets caught and flushed away. The system works beautifully. But here's what happens with time. Every year, every month, every meal, that strainer collects microscopic residue, tiny calcium deposits, mineral buildup, oxidative waste from processed food. And unlike a real strainer, you can't pull it out and scrub it clean. The mesh gets narrower. The flow slows down. But, and this is the part that gets owners into trouble, the water still drains. Just slower. Your dog still eats, still drinks, still wags their tail when you come home. You see a dog who's aging, maybe a little tired, a little stiff. What you don't see is the kidneys compensating. Your dog's kidneys are made up of roughly 400,000 tiny filtering units called nephrons. Think of each nephron as one small hole in that mesh strainer. When some nephrons fail, the surviving ones work harder. They pick up the slack. They enlarge. They filter faster. And for a while, the system holds. Your blood work comes back normal. Your vet says everything looks fine. But here's the clinical reality that keeps me up at night. By the time those blood markers actually shift, by the time creatinine levels rise enough for your vet to flag it, 75% of your dog's kidney function is already gone. Not 10%. Not a quarter. 3/4. Destroyed. Permanently. That means the window where this disease is still manageable, still responsive to dietary changes and intervention. That window is open only while the signs are subtle. Only while they're easy to miss. Only while you're telling yourself everything is fine. And when you take a dog whose kidneys are already silently struggling and you pour calcium supplements into their food every day, you're not strengthening their bones. You're calcifying their organs. You're turning that mesh strainer into concrete. I've spent 22 years in veterinary internal medicine. I've treated over 4,000 dogs with chronic kidney disease. 4,000. And the question that follows me home from the clinic, the one I think about while I'm making dinner, while I'm brushing my teeth, is always the same. How did it get this far? And the answer, more often than I'm comfortable saying out loud, was sitting in a pill bottle on the kitchen counter. A supplement the owner bought because they loved their dog. Because they wanted to help. So let me tell you exactly what to look for. The danger that hides best, the one that slips past even careful owners, is excess calcium and phosphorus. And it hides because it looks like the opposite of a threat. It looks like care. When your dog turns 7 or 8 and starts slowing down, stiffer in the mornings, hesitant before stairs, the instinct is to think about bones. Bone health. Bone strength. And if calcium is good for your bones, it must be good for theirs. That logic feels bulletproof. It isn't. Here's what actually happens. When you give a senior dog supplemental calcium, whether it's calcium carbonate, calcium phosphate, bone meal powder, or dicalcium phosphate, those minerals flood the bloodstream. A young dog's kidneys can handle the excess. They filter it out, flush it away. But an aging kidney, already losing nephrons, already compensating, it can't keep up. The calcium and phosphorus stay in the blood. Levels climb. And the body, in a desperate attempt to restore balance, starts depositing that calcium into soft tissue, into the walls of blood vessels, into the lining of the gastrointestinal tract, and into the kidneys themselves. It's called metastatic calcification. The body is literally turning its own organs into calcium deposits. And here's the regulatory gap that makes this worse. AAFCO, the organization that sets nutritional standards for pet food, has no official nutrient profile specifically for senior dogs. None. That means over-the-counter supplements marketed for aging joints or senior bone health have no regulated ceiling for how much calcium or phosphorus they contain. I had a patient named Penny, Labrador, 11 years old. Her owner, a retired teacher named David, had been adding a bone meal powder to her food for almost 2 years. He ordered it online. The label said natural and veterinarian recommended. When Penny came to me, her kidney values were in free fall. She was drinking water like she couldn't get enough, which she couldn't because her kidneys had lost the ability to concentrate urine. Her body was flushing fluid straight through. Penny's kidneys were already past the 75% damage threshold. The bone meal didn't cause her kidneys to age, but it accelerated the destruction by years. Go look at your dog's supplement label tonight. Read the first 5 ingredients. I mean it. Just read them and sit with what you find. But calcium rarely travels alone. And the companion it usually comes with is, in many ways, more immediately dangerous. Vitamin D3, cholecalciferol. It's paired with calcium in almost every bone health supplement on the market. For humans, it's essential. For dogs, especially senior dogs, it can be lethal at doses most owners would consider tiny. Dogs do not metabolize vitamin D the way we do. Their bodies are far more sensitive to it. The toxic threshold in a mature dog can be as low as 2 milligrams per kilogram of body weight. For a 30-pound dog, that's a startlingly small amount. And when vitamin D levels spike, they drag calcium levels up with them, creating the exact same cascade of calcification and kidney destruction I just described, except faster. Sometimes within hours. There was a dog named Maple, 28 kilograms, about 61 pounds. She got into a bottle of her owner's vitamin D3 soft gels. Not the whole bottle. A handful. She had to be hospitalized for 72 hours. Continuous forced saline flushing through her kidneys to prevent acute renal failure. She survived. Barely. But the version of this story I see more often in my clinic is quieter. It's not the dramatic poisoning. It's the owner who gives their dog a small daily dose of a human supplement that contains vitamin D quarter tablet. Half tablet. Every day. 4 months. The damage doesn't announce itself. It accumulates silently, behind normal-looking blood work, until the kidneys cross that invisible threshold and the symptoms finally break through. By then, you're managing decline, not preventing it. If there is a human multivitamin or calcium supplement anywhere near your dog's food, move it tonight. That's not an overreaction. That's informed caution. And here's the part that haunts me most, because this one doesn't even announce itself on the label the way you'd expect. Xylitol. You may know it as birch sugar or wood sugar. It's a sweetener, perfectly safe for humans. For dogs, it triggers a massive, rapid insulin release that crashes blood sugar to fatal levels, profound hypoglycemia, followed by acute liver failure. It can happen within 30 minutes of ingestion. Where does it hide? In sugar-free human gummy vitamins, in chewable melatonin tablets, in liquid health supplements. Owners who give their anxious or sleepless senior dog a natural melatonin gummy, one designed for people, may be handing their dog a dose of something that destroys their liver before the next morning. ASPCA Poison Control reports that human supplement toxicity is consistently among the top 2 most common over-the-counter poisoning calls for pets. Not chocolate, not grapes, supplements, from owners who were trying to help. Now, before I tell you what actually works, which in my experience is the most underdosed and misunderstood supplement in veterinary medicine, I want to mention something briefly. I've put together a complete guide that covers every dosage, every label to avoid, and every safe alternative in more detail than a single video allows. The link is in the description. So if calcium is out, and vitamin D is out, and half the chewable supplements in your medicine cabinet may contain a hidden sweetener that can kill your dog. What actually works for aging joints and chronic inflammation? Omega-3 fatty acids, specifically EPA and DHA, eicosapentaenoic acid and docosahexaenoic acid. These are the active anti-inflammatory compounds found in marine fish oil. Here's what they do. When your dog's joints are inflamed, which in a senior dog is essentially constant, low-grade, and cumulative, the cell membranes in those joints are loaded with a compound called arachidonic acid. That compound is the raw material for prostaglandins, the molecules that drive pain, swelling, and cartilage degradation. When you consistently introduce EPA and DHA through diet, they physically replace arachidonic acid in those cell membranes. Less raw material for inflammation. Less prostaglandin production. The joints don't just feel better. The chemistry of the tissue changes. And critically, this happens without any burden on the kidneys. No calcium. No phosphorus. No mineral load. The kidneys are left alone. A multi-center study published in the Journal of the American Veterinary Medical Association found that dogs given therapeutic doses of marine-based omega-3s showed significantly improved ability to rise from rest and to walk normally within 12 to 24 weeks. Not a miracle, a measurable, replicable clinical improvement. Here are the doses. 4 small dogs under 25 pounds, 300 to 800 milligrams of combined EPA and DHA daily. 4 medium dogs, 25 to 50 pounds, 800 to 1500 milligrams. 4 large dogs over 50 pounds, 1500 to 3000 milligrams. Use liquid fish oil, a pump or a soft gel you can puncture and squeeze onto food, or whole sardines packed in water. Look for the NASC seal, National Animal Supplement Council, on any product you buy. And check the label for 2 things that should not be there: added vitamin D and added calcium. If either one appears, put it back on the shelf. I had a patient named Duke, Rottweiler, 9 years old. He'd stopped climbing the 3 steps to his owner's back porch, just stood at the bottom and looked up. His owner, a man named James, started him on a therapeutic dose of fish oil. Nothing else changed. 8 weeks later, James sent me a video. Duke was standing on the porch, not running, not jumping, just standing up there, looking out at the yard, the way he used to. Sometimes the evidence is quiet. 3 dangers. 1 safe path forward. And they all connect through the same organ, the kidney. Everything I've described today is either protecting that filter or destroying it. The calcium that hardens it. The vitamin D that overwhelms it. The hidden sweetener that bypasses it entirely and attacks the liver. And the omega-3 that reduces inflammation without ever touching it. That's the whole gain. Baxter, the golden retriever I told you about at the beginning. We pulled the calcium supplement immediately, adjusted his diet to a controlled phosphorus senior formula, started a therapeutic dose of fish oil. And I'll be honest with you, we couldn't undo 6 months of calcification. Some of that damage was permanent. But 8 weeks later, Claire sent me a photo. Baxter was lying in a patch of sun on her living room floor. His head was up. His eyes were open. He was watching a squirrel through the sliding glass door. Not chasing it. Just watching. Just present. Claire called me the following week. And the first thing she said, the sentence that I hear in my sleep, the sentence that's part of the reason I'm sitting here recording this, was, "Why didn't anyone tell me this sooner?" Between 10 and 30% of dogs over the age of 10 develop chronic kidney disease. That number climbs every year past 7. The people who catch it early are not luckier. They are more informed. That's the only difference. If someone in your life has a dog over 7, what you just heard may be the most useful thing you can pass along to them. And before you change anything, a supplement, a diet, a routine, bring this to your vet first. They know your dog's blood work. They know the history, the breed risks, the medications. Bring them better questions and they will give you better answers. That's how this works. That's how it's always worked. The information just has to reach you in time.